5 years back. No roads, no electricity, no communication. Good morning, everybody. Thank you for the introduction. First of all, I want to thank Meena Undavali and Sai Undavali for giving this platform, along with Rama and the team, for interacting with you today. It's quite nostalgic for me here because I'm a product of Osmania University. Way back 78 and 79, I joined medical school, Osmania Medical College here. I want to tell you that I graduated from Osmania Medical College with a cost of 470 rupees. That's all I have spent to become a medical graduate. This country has given me so much. And then the second nostalgic thing for me here is we are in the auditorium named after Professor G. Ram Reddy. I had quite a bit close interaction with him. His son was my colleague, and we used to regularly interact with Professor Ram Reddy Garu during his UGC days and then the district education, because he's the Karta of district education in our country. So, given that background, I will start my journey of running the NICE Foundation for the last almost 2.5 decades. A situation took me way back in 90s to the tribal regions of our state, the combined state, Andhra Pradesh, the region called the Paderu. Our sister organization was working with the tribals in that region. So, knowing my background of being a neonatologist, I was working in a corporate world at that point of time. The CEO of the foundation, the Nandi Foundation, asked me to visit the region and then come out with a solution for the tribals in healthcare. India is a country of numbers, as you know, and we spend very little on health. And that also, we are running programs which are not giving the optimal results. Given that background, I, as a professional neonatologist, my business was saving newborn life. We were feeling very proud that selling 800 gram in the ICU, we used to think that we are next to God. In that background, I had gone to the tribal regions. So that took me to the tribal region. So when I looked at everything was a chaos there. So given that, I wanted to do a bit of survey to understand the population need and necessity of healthcare intervention. So I told my team that let me visit some villages. I want to interact with the communities. So when I started listening to them, the typical story was a young girl, because at that point of time, childhood marriages were the rule of the day. Young girl gets married, and then 16 or 17, she becomes pregnant, and then no antenatal care, and 9 months journey goes on, and then the D-day comes where the labor pains start, and that she has no clue what is in store for her. The only available resource for her is a traditional healer in the village. And this traditional healer tries all sorts of things, from doing rituals, pouring oil or hot water on the abdomen, belly, doing massage, you name it, scarring the belly line. Every possible criminal activity is done on to that pregnant woman. And after all that, she gives up and says, I can't do anything, you need to take her to a healthcare facility. Most of the time, it's on a rainy day or in the middle of the night. And this woman will be carried by 4 able men of the village on a thing called Joli. And then the distance to the nearest healthcare facility will be anything between 2 to 4 hours. Imagine the plight of that pregnant girl in active labor, going through the pain and not knowing where she's going. Most of the time, every village had a story which the woman gave up midway. Means to say, we lost the expectant mother. Some of them lost their babies. Some of them were made to the healthcare facility are told nobody is available. You need to go to a higher center. And some of them came back into the village and landed up into trouble. Every village had a story like that within 5 years of the tenure which I visited. When we interacted with husbands, we found some husbands who lost women. See, normally the tradition in that culture is that if a wife dies, he marries the younger girl, the sister of the deceased. Some husbands lost both wives. So that's the story I got into at that point of time. Things have changed now, but that was the background. Here I was, working in an ICU, trying to save newborn lives and feeling that I'm doing the ultimate. And then here, the situation was something completely different. That was the time I made my decision of changing my direction. From the ICU, the comfort of an ICU, into the remote regions of the country. India spends very little money on health, and certain sections of the society have not took the benefit of the advances which we are making. We may be economically improving, healthcare may be accessible to certain urban and semi-urban areas, but when it comes to tribal regions, it is inaccessible. So we took that journey of trying to address the needs of the deserving or the neglected sections of the society. That's how our journey of NICE Foundation started. So I'll run through some of the slides. This is how the woman is carried on a trolley to the nearest healthcare facility. Even today, this happens. This picture was taken 1.5 years back. A woman crossing the stream in active labor, carried by a woman. And then a trolley where more able people are taking her to the nearest healthcare facility. So given this background, we came out with a model where we identified educated, sometimes qualified nurses from the region, skilled them up to the need and necessity of the time, and then employed them and started the service called a fixed day service. So in every tribal village, we run a clinic 2 hours every week once. Some regions we visit twice a week. So as to, we are trained them in safe delivery procedures, bringing them to Hyderabad in our facility in Hyderabad, skilling them, making them able, capable, and then putting them back there. There are some roads where they can go on 2-wheelers, 4-wheelers, and there are kacha roads they need to travel. After that, the ritual starts. These are my team members. This is happening in the present seasons also. This is not an old picture. This is the last year's picture, last season. And we, irrespective of the situation, whether it is a holiday, monsoon day, curfew day, we run our clinics on the stipulated time in these regions. That's how we got the confidence of the communities. The moment we reach, our team reaches, the community comes and for the services. Antenatal care happens. And then some women who don't come to the facility, we go to their village or to their houses and then examine their babies and themselves, checking their weight. And then everybody's needs are addressed as far as healthcare is concerned. This is the last mile healthcare delivery model. Children, women, and in every village there are some women who are bedridden. Even in the small hamlets, 1 or 2 women are bedridden. We, after running the clinic at a stipulated place, my team members go to the village and do provide the service at the doorstep. Not only that, we have also taken on a path of empowering the community through the activity of PLA, participatory learning and action. We understand their problems and make themselves come out with a solution and see that they follow that solution uniformly. This is one such activity in a tribal region called Mananur Forest in Telangana. And then we also do PDG activity, participatory discussion group activity, wherein expected women and then lifestyle disease patients are educated on their problem to address their problems. After coming this far, we found that there is a need to build the capability of the traditional healers whose the community has confidence in. So we built up a capabilities of the traditional birth attendants through a program called TPA training program, wherein they are trained how to resuscitate a newborn, how to conduct a clean delivery. This is one such training module. So you can see the confidence of a tribal resuscitating the newborn. Obviously it's a mannequin which she's experimenting on. Even my neonatal unit fellows, I don't see that much amount of confidence when they're resuscitating a baby. You can look at the smile and the confidence and then with which the posture she's able to handle the prospective newborn. That is the tribal program which we are running. We are running in 864 villages in 5 states in the country at this point of time. Then the next program of ours was school healthcare program. In our country, the poorest of the poor send their children to the government school. Even if you have a little bit of money, you send them to a private school. Only children whose parents cannot afford anything send their children to government schools. For me, he is the first citizen of the country. The child who is accessing the government school is the first citizen of the country. I'll tell you why. He would not have eaten that day. Because we have done a study. 14% of government school accessing children in Hyderabad 10 years back, the midday meal was the first meal. In a city like Hyderabad, we are working in 256 government schools in Padmanabh, Bandaguda, Asif Nagar, Shekhpet and Golconda schools. This is the statistics. I don't think it has changed much even now. So this child, parents not educated, there are no books much, no clothing much, stomach empty, and then he's going to a school which may not be functioning well, teacher may not be coming well, in spite of all these compromises. This child is accessing the school to become himself an educated citizen of our country. We need to support this sort of a citizen. That's the reason why I say the first citizen of the country is the government school accessing child. So this program we started as a school healthcare model, which we implemented in Hyderabad and went to Rajasthan. And then after our success story, 11th 5-year plan of the country took up this model as a model for the country. So these are some of the pictures of the school healthcare intervention program which we are running now. We also try to educate children because we found that educating a children is like educating the family. So all the basic habits and clean hygienic methods of living are educated to these children. Hand washing, this we started much before COVID. So it was helpful for us. These are all before COVID. And we also use transit walks in the village, just for the word and play. Those sort of activities we entertain and educate the communities through children. And then about the nutrition. Today's world, as you know, educated, uneducated, rich, poor, what we are eating is not appropriate. There is a need to eat the right kind of food. So we take efforts to see that these children are educated on the best habits of eating. And then this again, hand wash. In this background came the COVID. So we were working working in tribal regions. We are working in Gomriguda, Ukumbeta, Munchunguta, Anandagiri, Chittapalli, Madugula, Araku and Paleru, mandals of Visakhapatnam. We are working for the last 20 years now. So we found that we were the only support for them during this period. And then quickly, within 2 weeks' time, we turn around. We build the capabilities of ASHA workers in villages where there was an ASHA worker. If there was no ASHA worker, an educated girl, we trained them through our online training platform module, how to record a temperature, and then how to do the pulse oximetry, and then whoever is having temperature or a low saturations were again confirmed through a rapid antigen test, and then if they are found positive, we were giving the drugs. This we effectively ran for 2.5 months. In this period, in that period where there was no way there was any access to healthcare in these regions. 1,800 villages we covered during that time. 28 patients were positive, were moved to institutions. All of them have come back to their villages. Then we also promoted the vaccine uptake in these communities. This is all because time was short. I didn't want to take. We are doing many more projects. We do cluster randomized trials in the field, and then we are also doing different templates. The college community intervention program, and then of late we have graduated to a program called Adarsha Grama, where the focus is on pre-primary care. India is a country of numbers, and then we may be having the maximum number of young population in the world, but we also are known for the diabetes capital of the world, and we are also very soon will be known as the cancer capital of the world. There is a need to create awareness in the community in terms of eating habits, in terms of lifestyle diseases, and in terms of cancer detection, and then further care. We are on that journey, and then the idea is to create new templates as the stakeholders to take it further. That's the principle of our partnership. Thank you.
Thank you very much. Thank you very much, Dr. Padmanabh Reddy Garu, for highlighting the crucial message that healthcare is the basic human right. May I now invite Veena Gundavelli to come on board and give a memento of appreciation for Dr. Padmanabh.
Before that, if there are any queries,
please go.
Doubts or anything which somebody wants to,
Sir, first of all, I appreciate it. Sir, somehow are you connecting nursing colleges for such a foundational work? Because your work goes to grassroots level. So these upcoming nursing students who are always looking for the hands-on practices of such kind of activity. So sir, any strategy or plan we have as a nice foundation to connect different nursing colleges across India so that anyone can reach out to you?
I also was in that mode before I reached those places. So the reality is, in our country, tribals are positively discriminated. When I say positively discriminated, when an educated girl who becomes a nurse, she is immediately absorbed into the government system. Once that girl gets into the government system, she doesn't want to come back to the tribal region. So the regions which we work, we don't have healthcare people at all. So the idea of getting connected to the nursing colleges does not happen. So that's point number one. The second part of it is, the community believes in the traditional healers. At this point of time, they are the only support systems for them. So we are working through them. We are building the capabilities and capacities of the traditional healers and traditional birth attendants to see that they are my last mile soldiers to deliver care. We are also recognized by the Skill Council of India to run skilling programs. So we skill and certify programs in those regions. We run a program called Arogya Dut program, where home health care professionals we train through a 45-day module, which is certified by the Skill Council of India. So that's the need of the hour.
Thank you so much, Dr. finding purpose in helping in your own field in different ways to the community. And here there are aspiring whether it's medical professionals or engineers, etc. So is there any way any of these people can add, contribute, and be part of the mission that you have established?
So we run effective internship programs. We are open to interns coming in and going through our programs, and then we have support systems. We all the time we are associated with 3 Western world universities. We get faculties from there. We have exchange programs. So there is a lot to learn in these programs. So I would encourage people during your summer vacations, try to spend some time with us. And then, because I'll tell you, my journey, I was educated in a government school and even today, those learnings are fresh in me. So during that time, when I was a young child, an American couple came to my village. Through the day, they examined all the people of the village, and in the evening, they showed a film connected with agriculture and nutrition. To date, it is embedded in me. That is the seed of what we are doing to the community now. So the purpose of me standing here, sharing this information with you all, is so that we want to ignite that in you. Because someday, some opportunity when you get available. And then I got the opportunity, the biggest in my life. I'm enjoying it. I got retired when I was 40. I don't do commercial work. I'm only running the foundation and trying to do the best for the community silently.
Thank you so much, and a big call out for all the students who are interested in any sort of internships. You can be in marketing and promote the cause. You can be in finance and support, whatever the activities they're doing in finance department. You can be an engineer. You can do data analytics. You can do, all sorts of, technology work, for this particular one. So please meet later on, with Dr. Padmanabh and sign up with the NICE Foundation for additional activities. Thank you so much. Just a moment.
Please look.
Now we will have a small AV on TAL giving.